Hello everybody, this is Gary. Today is April 6th, 2022. It is 11:30 p.m. Eastern Standard Time in Rochester, New York, the United States, and this is my coping with schizophrenia blog entry for today. Today I'm scheduled to see my primary caregiver, the nurse practitioner. We're going to discuss how I've been doing with my physical pain. I talked to my orthopedic surgeon this morning. We scheduled my surgery on my right knee for April 29th of this month. They're going to remove my torn meniscus in my knee. I also have a bruise on one of the bones in my knee, but that's going to have to heal on its own. There's nothing they can do surgically about that. I thought it was a fracture, and it's more of a bruise or an injury to the bone that will heal on its own. I still have some pain in my right knee. That's why I'm planning to go ahead with the surgery. The only other option was to inject my knee with a cortisone shot, and I doubted that would work, so I chose to schedule the surgery. I may be on crutches for a while, somewhat incapacitated for a little while. Not completely. Depends on what kind of movement I can tolerate after surgery. It varies from person to person. But the reason for the surgery, again, is because I have a torn meniscus in my knee. An MRI revealed that there was a torn meniscus, and I had two choices: either get a cortisone shot injected directly into my knee or go ahead through surgery. And I chose surgery because I think it would be a more permanent solution to the problem of the pain in my right knee. But anyways, I'm seeing my primary caregiver today. We're going to go over the fact that I'm having surgery coming up in a few weeks, and just go over the general pain that I've been having throughout my body. My primary care prescribed Cymbalta, which is an antidepressant, but it can be used to control musculoskeletal pain, arthritis joint pain, nerve pain, things like fibromyalgia, that kind of thing. And my pain throughout my body has been along the lines of something like fibromyalgia or chronic fatigue syndrome or whatever. We're not sure what the cause of the pain was. With the Cymbalta, seems to relieve most of the physical pain. The main pain that I'm having right now is in my right knee, and also my left shoulder. About 15 years ago, I dislocated my left shoulder, and I also had a detached clavicle. Obviously, they popped my shoulder back into place, but my clavicle is still detached, and it still hurts from time to time. I had fallen down the stairs and dislocated my left shoulder. I am getting older, and obviously physical pain and deterioration of the body is a part of getting older. So it is what it is. But the Cymbaltas help me with the physical pain as well as my insomnia and depression. My other psychiatric symptoms are not that severe. My paranoia is not that bad. My delusions are not that bad today. My auditory hallucinations are at a bare minimum. My depression is not that severe. My anxiety is kind of high. Probably too much caffeine, too much coffee. But generally I'm doing okay. Just trying to stick to my daily schedule. Did some work on my computer, or more accurately my tablet. I bought a new computer, but I haven't turned it on yet. Haven't programmed it. Haven't charged it yet. I bought a refurbished computer because it's cheaper than a new one. It's a laptop. I think it's a Dell, I'm not sure. Right now I'm using the Sylvania tablet to record this. But I'm seeing my therapist, I think on the 19th or the 20th of April, and my psychiatrist on the 18th or the 19th of April. I don't remember exactly when. But I'm going to ask my primary care if she can refer me to a care manager, because I may need help in getting my medications and doing food shopping and things like that after surgery. So I may or may not be on crutches. I may or may not be able to tolerate walking on my right knee. It's just impossible to know that ahead of time, so I may need help doing things like picking up my medicine. And obviously, as a person with schizophrenia, I can't go without my medicine. Some pharmacies deliver. I might be able to arrange that. But I'm also going to be required to do a COVID-19 test 3 or 4 days before surgery. I won't know the time of surgery until the day before surgery. I know where the surgery is going to be at. It's going to be at a clinic and not a hospital. The surgery should be pretty brief. I mean, 35 to 45 minutes, the doctor said. They're going to put 2 holes in my knee, one in the front of my knee, one on the left, one on the right. One will be a camera, and the other one will be a tool to remove the damaged meniscus. The surgery will be very brief and very quick, and I'll be able to come home the same day. I won't be in the hospital. The surgery isn't even actually taking place in a hospital setting. It's taking place in a clinic setting. So it's a pretty straightforward surgery. All surgeries have risk of infection and bad reaction to anesthesia, that kind of thing. But I've had plenty of surgeries before, and I've never had a problem with anesthesia. And I've never had a problem with infection up to this point from surgeries. But other than that, there's nothing else to report. Like, comment, share, subscribe.